My name is Emily Dugan and I have scoliosis. As most of you who are viewing this video know, scoliosis is a congenital skeletal disorder that causes curvature of the spine. I was diagnosed with scoliosis at age 10. I was referred to Dr. Craig Eberson at University Orthopedics in Providence, Rhode Island. I was advised that in the event that the curvature continued to grow, surgery was a possibility. Dr. Eberson continued to monitor me every 6 months. At age 12, Dr. Eberson recommended that I wear a night brace. I wore the night brace for some time, however the curve continued to progress. Dr. Eberson also recommended that I try a day brace, which I must admit I was not very diligent about wearing. Dr. Eberson also told me that even with bracing, it was still possible that I would need surgery. 5 years after being diagnosed, Dr. Eberson viewed the x-rays and told me that I was a candidate for surgery. I realized how nerve-wracking it is to be told you need a spinal fusion, and I was distraught when I heard the news. However, I hope that in sharing my experience with you, I can relieve some of the anxiety you may have about the surgery, because in retrospect, it was the best decision I have ever made. Good morning, my name is Emily Dugan, and I'm here this morning with my orthopedic surgeon, Dr. Eberson, who performed my spinal fusion. So I have a couple questions for you this morning. What is the name of the surgery, and when do you decide that it's imperative that a patient has it done?
Well, your surgery is what is called a posterior spinal fusion, and posterior means it's in the back. And we do that surgery for kids who have scoliosis. And when you have scoliosis, as you know, your spine is curved, and if it curves past a certain point, it'll keep getting worse and worse and worse, even when you're an adult, even when you're not growing anymore, and that can cause some health problems. So when we think it gets to that point, before it causes problems, we recommend surgery.
How would you describe in general terms the procedure?
Well, when you have this surgery, you go into an operating room and you're asleep, and we'll make an incision in the spine and expose the spine, and we put little screws or hooks into the spine, and then we can connect these little screws and hooks to rods. And we can manipulate the rods to change the shape of the spine. And once we're through with that, we do the fusion part of the surgery, when we kind of scuff up the surfaces of the bone and put what's called bone graft on top, and that'll all knit together so it becomes one solid spine that can't move again in the area where we work.
Like many of you, this has been a journey of mine over the course of many years. Dr. Eberson indicated that it would be 4 to 5 weeks before I might be ready to get back to school. 1 week prior to surgery, I went to Hasbro Children's Hospital for my pre-op. During this time, I toured the hospital and met with a team of anesthesiologists. In addition, we viewed the recovery room and the hospital rooms where I would be staying. I spent the days leading up to surgery vacationing in the island of Nantucket, trying to forget the impending surgery. The day of surgery, I arrived at Hasbro at 6:30 a.m. and checked in. I can tell you that those 2 hours leading up to surgery were the worst 2 hours of my life. Everyone at Hasbro was amazing. The nurses, anesthesiologists, and doctors were all sympathetic, encouraging, and supportive. At about the time they were connecting the neurosensors on my head, I became very upset and teary. One of the nurses working with me immediately sensed my upset and fear. I vividly remember how she got down on her knees and gave me a pep talk, assuring me that everything would be just fine. Dr. Eberson was in the pre-op room when we arrived, already in his scrubs and chatting with me nonstop to help me relax. I was placed onto the operating table, and the last thing I remember was Dr. Eberson telling his silly jokes. I was out of surgery at 3:30 p.m. and in my room in the intensive care unit. Apparently, I was not in nearly as much pain as I thought, because the very first thing I asked for when I got into my room was my cell phone. What would have been the adverse ramifications if I had elected not to undergo the procedure?
Well, one of the problems with scoliosis is that if it gets large enough, even if you've finished growing, it's going to keep getting worse. And we all know that kids, when they grow, that's why they are checked for scoliosis, because sometimes as you grow, it gets bigger. If you get to the degree or the magnitude where yours was, it would have continued to get worse even in adulthood. And for a young person to have the surgery, it's a relatively quick recovery. It's a fairly straightforward operation. As the curve gets bigger and bigger and bigger, it gets more difficult to fix, and the risks go up a little bit. And the recovery for a 40-year-old to have this surgery is drastically different. And if you wait even longer, potentially it could affect the breathing and the heart and all the other medical issues that we worry about with scoliosis. So once we decide a curve has gotten to that point of no return where it's guaranteed to get worse, we usually recommend fixing it.
Thanks so much for all that you've done. It really has changed my life.
Fantastic.
Having the spinal fusion was the best decision I've ever made. I have no regrets and no more back pain. In fact, I also grew 1.5 inches as a result of the procedure. Within days of being home, I was walking through Rickford, Rhode Island and shopping. Within 6 weeks of surgery, I was able to begin an exercise regime again. 18 days after surgery, I was able to attend my first day of school as a junior at LaSalle Academy. I hope this video helps to relieve some of your worries, as although they are natural, they are not needed. The surgery was well worth and not nearly as bad as I had anticipated. I wish you the best of luck. Thank you for allowing me to share my experience with you.